Have you ever pondered over how statins work in your body? It's a question that leads us into the fascinating world of these powerful drugs. Statins, also known as HMG-CoA reductase inhibitors, are a group of lipid-lowering medications that have revolutionized the management of high cholesterol. They are the go-to drugs for doctors aiming to reduce cholesterol levels and, consequently, the risk of heart disease in their patients. This is because statins directly inhibit the action of HMG-CoA reductase, the rate-limiting enzyme in hepatic cholesterol synthesis. In simpler terms, they slow down the production of cholesterol by the liver, helping to keep cholesterol levels in check. They have a pivotal role in cardiovascular health, especially in people with conditions like stroke, ischemic heart disease, and peripheral arterial disease. But like all drugs, statins also have their side effects and contraindications. Now that we know what statins are, let's delve into how they work. Statins are like the traffic cops of your bloodstream, maintaining order and preventing chaos. Now, this might sound a bit dramatic, but it's a pretty accurate metaphor for how these drugs work. So let's break it down. Statins are a class of drugs that are primarily used to lower cholesterol levels in the blood. But how do they do this? Well, it all starts in your liver, the organ responsible for producing cholesterol. Your liver uses an enzyme called HMG-CoA reductase to make cholesterol. Think of this enzyme as a key that starts the engine of cholesterol production. Now here's where statins come into play. Statins work by binding to this enzyme, effectively blocking it from doing its job. This action is akin to a traffic cop putting up a stop sign at an intersection, halting the flow of traffic. By inhibiting the action of HMG-CoA reductase, statins slow down the production of cholesterol in the liver. But the story doesn't end there. When the liver can't produce as much cholesterol, it compensates by taking more cholesterol out of your blood. It does this by increasing the number of low-density lipoprotein, or LDL, receptors on its surface. These receptors grab onto LDL, the bad cholesterol floating in your bloodstream, and pull it into the liver where it's broken down. So, in a way, statins not only slow down the production of cholesterol, but also help to clear it from your blood. This dual action results in an overall decrease in your blood cholesterol levels. And lower cholesterol levels mean less plaque buildup in your arteries, reducing your risk of heart disease and stroke. But remember, while statins are effective, they're not a magic bullet. They work best when combined with lifestyle changes like a healthy diet, regular exercise, and not smoking. So in essence, statins keep your cholesterol levels in check by regulating its production. And that's how these traffic cops of your bloodstream help maintain order and prevent chaos in your cardiovascular system. Like all medications, statins also have their side effects. One of the most common adverse effects is myopathy. Myopathy can manifest as myalgia, myositis, rhabdomyolysis, or just an asymptomatic increase in creatine kinase. It's more common with lipophilic statins like simvastatin and atorvastatin, as opposed to their hydrophilic counterparts such as rosuvastatin, pravastatin, and fluvastatin. Risk factors for myopathy include advanced age, being female, having a low body mass index, or living with a multi-system disease such as diabetes mellitus. Liver impairment is another potential side effect. Guidelines recommend checking liver function tests at baseline and again at 3 and 12 months. If serum transaminase concentrations rise to 3 times the upper limit of the reference range and persist, treatment should be discontinued. There's some evidence suggesting that statins may increase the risk of intracerebral hemorrhage in patients who've previously had a stroke. However, this effect is not seen in primary prevention. While these side effects may sound scary, remember that your doctor has prescribed statins because the benefits outweigh the risks. So, who should be taking statins? Well, these are typically prescribed to people with established cardiovascular disease like stroke or ischemic heart disease. Following updated guidelines, anyone with a 10-year cardiovascular risk equal to or greater than 10% might also be advised statins. Patients with type 2 diabetes are assessed using the CRISC-2 to determine if they need statins. Also, individuals with type 1 diabetes diagnosed over 10 years ago or above the age of 40 may be candidates. If you fall into one of these groups, your doctor might recommend statins to help manage your cholesterol levels. In conclusion, statins play a crucial role in managing cholesterol levels. They function by inhibiting the action of HMG-CoA reductase, a key enzyme in cholesterol synthesis. While effective, they can cause side effects such as myopathy and liver impairment. Statins are particularly recommended for people with cardiovascular disease, a high 10-year cardiovascular risk, or certain types of diabetes. The optimal time to take statins is at night, when most cholesterol synthesis occurs. Remember, it's important to take your medications as prescribed, and always consult with your healthcare provider if you have any concerns.